Masking up, washing your hands, and the national debate around mandatory vaccination may seem like modern issues, but a visit to the Public Health Museum in Tewksbury quickly proves that there is nothing new under the sun.
By 1809, Massachusetts required smallpox vaccination with cowpox virus.
That's right. 40 years before California even became a state, Massachusetts had a vaccine mandate.
And it was so successful, by 1837, people said, well, we don't have smallpox anymore. We shouldn't need to do it. So they reversed the law, and smallpox came back.
Dr. Al DeMaria is president of the Public Health Museum, located at Tewksbury Hospital.
The Public Health Museum opened in 1994, but it was really the dream of some visionary public health people who decided that the public really doesn't understand public health.
DeMaria says the role of public health in society is often underappreciated because, like the smallpox vaccine, it worked.
What we think of now in terms of cardiac disease, heart disease, stroke, those kinds of things, cancer that kill people today, killed people back then, but that's only if they survived the infectious diseases that they had, like smallpox, like tuberculosis, to get to an age where they could develop those illnesses.
One huge reminder of the advances made through public health sits in the center of the museum in the form of this iron lung, a critical life-saving tool for victims of polio.
It's a generational thing. Some of the older people remember, and they might even know somebody was in an iron lung, but the younger people, you know, it's amazing to them that you would have to do this.
As with smallpox, it was a vaccine that eradicated polio, putting large wards where these machines were used out of business.
Vaccines have saved more lives than anything else we've done.
You will find many other exhibits at the museum on subjects ranging from mental health to the history of visiting nurses. But as the world struggles to manage a modern public health crisis, DeMaria says a key message may be this one, introduced in 1962.
You know, I heard somebody say only 1,200 kids died of COVID. Well, that's 1,200 too many. And if you could prevent those, why wouldn't you prevent those?
So interesting, and Dr. DeMaria is more than just a museum director. He's also a public health expert.
Oh, absolutely. For many years, he was the head of the state's Bureau of Infectious Diseases and the state epidemiologist, so he has a lot of knowledge and history. Interesting, with all the controversy that there may be, to look back on the history of vaccines and vaccine mandates. And that is Chronicle for tonight. Thanks so much for joining us, everyone. I'm Anthony Everett.
And I'm Shayna Seymour. Have a good one. We'll see you back here tomorrow night.